All right, good afternoon, everybody. We welcome each of you to the Building Strong Brains webinar series. Since its inception, Building Strong Brains Tennessee has connected brain science and communication science to change the culture in Tennessee to be informed by ACEs, trauma, and resilience. And this culture change has prompted many professionals, communities, and philanthropists to use the latest brain science to better prevent and mitigate ACEs, trauma, and toxic stress. 4 years of comprehensive, coordinated, and collective work from both the private and public sectors have positioned Tennessee as a national leader in ACEs response. With your leadership and collaboration, we hope this webinar series will propel and expand cutting-edge work as we support professionals and community members to learn from innovative efforts happening at the national and local levels. We also hope that participants will consider ways to promote more equitable communities for all children and families. We remind everyone that you are on mute and will be unable to unmute yourself. Please post questions in the chat box for the presenter's response at the end of the presentation. This webinar is being recorded and will be uploaded to the Tennessee Commission on Children and Youth YouTube page. Finally, if you receive a survey from us in the future, if you'll fill it out and let us know if this is a useful and helpful webinar series or ways that we can improve it for you, we would love to hear that feedback. If you're interested in receiving notice of future Building Strong Brains webinar opportunities, please email me, Jennifer Drake Croft, at jen.croft, C-R-O-F-T, at tn.gov. Now, I'd like to introduce our wonderful speaker and my friend, Dr. Wallace Dixon. So Dr. Wallace Dixon has served as chair and professor of psychology at East Tennessee State University for nearly 20 years. He also serves as founding director of the Ballad Health ETSU Strong Brain Institute, which stands for, BRAIN being an acronym, Building Resilience Through ACEs-Informed Networking. This was established in the spring of 2020, in large part through a 5-year gift from Ballad Health. While at ETSU, Dixon established Ph.D. programs in clinical, primary care, and experimental translational psychology. He has received funding from the National Institutes of Health for his research on temperament and cognition in infants and toddlers. He has authored 2 books, Parenting with Reason, Evidence-Based Approaches to Parenting Dilemmas, and 20 Studies that Revolutionized Child Psychology, and more than 35 book chapters and scientific journal articles, and has delivered more than 100 scientific presentations at international child development conferences. Dixon is well-versed in ACEs science, the prevention and mitigation of ACEs, and the communication of ACEs messaging. He has a strong collaboration, obviously, with the Building Strong Brains Tennessee effort and the Tennessee Commission on Children and Youth. So without further ado, I'm going to mute myself and let Dr. Dixon take over.
Thanks, Jen, and I hope that you will come on and let me know if something has gone awry, such as you're become unable to hear me, or if my screen goes off to the side.
I most definitely will, and I'll text you if that's the case.
Okay, well, I'm setting my timer to make sure I'm on time. I will say that starting out that this is kind of well, first, it's pretty weird. I can't see anybody. This is probably the first presentation where I can't actually see anybody who's in the audience. So welcome. I know some of you, I can see some of your names. This is kind of the circle of life, because my involvement in this effort started with Building Strong Brains Tennessee with their inaugural event, and I'll talk about that in about 2015 or so, and come full circle, and here I am doing a presentation about the product of that. So the Strong Brain Institute is really the child, one of the many successful children of the Building Strong Brains Tennessee effort. So as Jen said, I am the founding director of the Strong Brain Institute. It's one major hat that I wear. I'm also a department chair of the Department of Psychology at East Tennessee State University. It's another hat that I wear. I also try to do science, publish papers, I've recently been elected to the chair of the board for the Council of Graduate Departments of Psychology. So just a couple of terms here. BRAIN is an acronym. One of the things that I've learned in this space is that everything's called brain something or strong something. So we put it together, it became the Strong Brain Institute, or we call it locally the SBI. We started calling ourselves, when we first proposed the idea for a formal initiative on our campus at ETSU, President Noland asked us to present to the Board of Trustees. And I thought that would be great. And as I began to think about how we should call ourselves, it occurred to me that if we're going to be members of the Brain Trust, we're Brain Trustees. So we came up with the title for ourselves as Brain Trustees. And we're pretty much the core steering committee members of the Strong Brain Institute. And I'll also say that our focus has morphed primarily into promoting resilience, a lot more focused on resilience than on trauma or trauma mitigation. And I can talk a little bit about why we did that as I move through the slides. So who we are? Well, at present, we're about 20 people. The Brain Trust is about 20 different people. We have 2 full-time staff and a few associates and mostly faculty from across the ETSU campus. We have every single academic college represented on our board. And there's 8 academic colleges on this campus, so we have somebody from every academic college and 11 different academic departments. Here's who we are. I don't expect that you'll be able to read this, but it just does show the range. We have several department chairs. We have 1 dean that is involved, several faculty. Becky Haas is among us, among our group, serves as an independent consultant. So this just shows the range of the membership of the Brain Trust. This is what we look like to most people. This is the picture that we took when there was a press release announcing our existence. I believe this was June 26th. And it was the first time that we all got together after we shut down. And so this was kind of exciting in many ways and scary in many ways. But that was a great picture. But this first thing I thought of when I saw this picture was that this is what we look like to most people, but this is how we actually function, kind of as superheroes. And the reason I say that is when you work with people so interdisciplinarily as we do, the products that you produce are so much better than any individual product that 1 person or 2 people could produce. And what I learned, just like the Avengers, is that certain people have certain skills. Not everybody has the same skills. So certain people in our group bring certain kinds of skill sets. Some are big picture thinkers, some are detailed thinkers. We have 1 person on our group who's excellent in making acronyms. We have scientists, some are stronger in psychometrics, others are stronger in research design. And as a team, we really produce foundational and awesome products. So this is kind of an origin story, and I actually don't like origin stories that much. I'm the kind of person that if somebody wants to show me their baby pictures, I kind of roll my eyes and like, oh, okay, yeah, I'll be happy to see your kids. But then as I start looking at the kids, I become enthralled and I become interested, but I'm immediately averse to stories, storytelling that people share with me. So I imagine some of you are like me and may be averse to storytelling, but this is really a story. And the reason I think it's important to tell the story is for you to think about how you could be involved in a similar story in your neck of the woods. So I have to say that the story started, I have to recognize my wife, Dr. Michelle Moser. Dr. Moser's known through many parts of the state, and particularly for the Centers of Excellence and for Children in State Custody, but also was on the founding group that formed Aim High Tennessee, the Association of Infant Mental Health in Tennessee. And she's the one who basically pushed me into this. 5 years ago, I wouldn't have heard about ACEs. I knew nothing about them. And here I am directing a center that focus is to prevent and mitigate ACEs. But the reason that happened was being in the right place at the right time. At about the same time that BSB-TN was kicking off, I was a presidential fellow under President Noland at ETSU. And basically that was a leadership development opportunity I took part in. President Noland was interested in developing future leaders on campus, and I participated in that. You know, I didn't know what would come of it, but I just thought it'd be a good thing to do to get to know President Noland. He got invited to the inaugural, the kickoff event that BSB-TN held, and he invited me to go as his designee. And I showed this to Michelle, and I said, he wants me to go to this thing. I said, I have zero interest in going to this thing. And Michelle said, you need to go to this thing. So I did go to this thing, and you know, I'm a psychologist and I study child development as a concept, but I don't work with children, you know, like professionally. I don't work to help children. I study them scientifically. So when I do work with children, it's basically bringing them into the research laboratory. I do, you know, some tests, I do some measurements, and then they leave, and then I write papers publishing my results. But I don't actually have any direct contact in children's services or family services or any sort of agency. And so when I went to this, the first event, the inaugural kickoff event, one of the first things I learned was everybody there was working with families or children. And I began thinking, why am I here? I work with college students. I work with faculty, university faculty. I work with administrators. I don't see the relevance of this. But if you know Michelle, then you know that she's persistent. And she made me keep going. And one of the other things that emerged shortly after the inaugural event was the Frameworks Frame Labs, where we learned about how to use science to communicate. That intrigued me because I've always been interested in using science to communicate. And so I decided I would go to the Frameworks Frame Lab. So I went to several of those. Meanwhile, and that took place over the course of maybe a year and a half, memory's evading me, but I learned a lot about how to frame, and I learned about the science of framing, all the while thinking, what can I do here, because I don't work with families and children. But the other thing they kept saying, particularly Mary Rolando kept saying, was we need higher education involved. And I'm in higher education, so I'm trying to figure out what can I do, what skills can I bring to this Building Strong Brains Tennessee initiative that would help or promote this effort within the context of higher education. So a couple of things came together. Whatever, you know, you think about a perfect storm, well, and usually that's bad. Perfect storm, a bunch of bad things come together and produce a bad outcome. Whatever the opposite of that is, what happened to me, it was like the perfect sunrise or rainbow or something. And because I was a presidential fellow at the time, I also happened to be leading the university's effort to develop a strategic plan for the next 10 years. And one of the things that we talked about on the strategic planning committee was how can we leverage ETSU's place in the mountains to make it attractive for students to come here? How can we stand out? How can we be special? And because I was co-chairing that committee, I had the catbird seat about directing what we prioritized. At the back of my mind, I'm thinking about, oh, I've been to the BSB-TN training about trauma informing things. And I began putting two and two together, and it occurred to me that if we could make ETSU trauma sensitive or resilience informed, we could make ETSU the only university in the country that had that designation. So I began thinking, okay, like there's something that we can do here. Because number one, we train students, and these students go out to be leaders in the community. These students go out to have families and have children. These students were children before, and they have trauma histories coming into the classroom. I know personally that many times there are challenges between faculty and students, you know, where faculty and students have disagreements about things. And because I'm a department chair, I'm the one who gets to hear about it. I'm the one who gets the complaints about it. And it occurred to me that one thing that I could do, if I could do anything, was work on trauma informing the entire institution of East Tennessee State University. It's not directly working with children or children's services, but indirectly, in the long term, it would have an impact. And so that's when I started thinking, this is a place where I can make a difference. I also had access to the president because of my experience as a presidential fellow. So I took this idea to him and said, hey, if you want to be special, this is one way that we can be special. Now, immediately, like, I don't think people saw the potential value of becoming resilience informed, trauma informed, but that was also about 5 years ago, before it was catching on fire. But I had planted the seed in the back of his mind, and so it was growing there. I also had access to basically the whole campus, and I knew a lot of people, and I found out that through my connections, many people on our campus, faculty, had received Building Strong Brains Tennessee innovation grants. 3 or 4 different people had received these grants, and so they were already doing the work of ACEs. Now, I was coming on the stage late, and so they were already doing the work, but the one thing that I could do, because of my experience as a department chair, was I could organize and I could network. And so what I started to do was bringing all the people on campus together who had an ACEs interest or an interest in working with ACEs. And so we began meeting probably monthly. I think that was probably sometime around 2017. And we began saying, okay, we all have this common interest. What are we going to do about it? What can be done? We organized as a body. We all kept coming, even though we didn't have to. This was an add-on to the day job. This was an add-on to teaching and research and service, which is what university faculty are always expected to do. And nevertheless, people kept coming to the meeting because they were committed to preventing and mitigating ACEs and addressing ACEs using, in our case, because we're university faculty, using science. And so we began brainstorming, we began thinking about how to do it, how best to do it, and we figured out that the best way to do it was to invite President Noland to our meeting, and we needed to get administrative buy-in. And because I had the access to President Noland, he became interested in what we were doing and agreed to come to a couple of our meetings. We presented the idea to him. We said we want to do something, but we'd like university, and the idea of what we would do is pretty amorphous at that point, but we knew that we wanted to do something and we wanted the university's support. So he said, well, why don't you come to the Board of Trustees meeting and get their approval, and then we'll move it from there. So we did. I went and I presented the Brain Trust's view of what we would be doing. We put together a prospectus. We presented it to the Board of Trustees. And then shortly after that, President Noland asked us, why don't you become a center? And we said, we would love nothing better than to become a center. How do we do that? We need money. He said, why don't you submit a proposal for some money? So we did. And I said, how much should we ask for? And he said, we don't know. Why don't you ask for $100,000 and we'll go from there. And then, so of course I asked for about $160,000. Nothing happened after we submitted that proposal for about a year. And then and so I thought President Noland had forgotten about the proposal. And I gave up on it for a while, or I sent a couple of follow-up emails, and it was nothing but crickets. And then the next thing I know, President Noland announced that he had been talking with Mr. Alan Levine, who's the CEO of Ballad Health, which is our regional health agency. And Ballad Health was willing to support our effort in the form of, it turns out, a $1 million gift over a period of 5 years. Let me say a little bit more before I get to the slide. So we were excited. We decided one of the first things that we would have to do is track out what our objectives were going to be, because it was going to be a real thing. Ballad had as its primary goal in the formation of this institute training of the community at large in trauma-informed strategies and practices. And I had the idea that I wanted to promote efforts to trauma-inform ETSU. But we also knew that we were professors for the most part, and professors are notoriously disconnected from the surrounding communities. At least that's the stereotype. Professors are in their silos, they do their science, they do their teaching, but they don't really communicate with the surrounding community. So one of the first things we decided we had to do was establish an advisory council of our community champions, people who would support our efforts, but who were also already engaged in efforts throughout the community in preventing and mitigating ACEs. And we came up with this group of people following the model of Building Strong Brains Tennessee. We identified multiple sectors that we wanted represented, municipal sector, state government sector, federal government sector, K through 12 education, higher education, student, business, commerce, and faith-based. And so we identified this list of folks. I emailed all them and asked if they'd be interested in serving on the inaugural advisory council for the Strong Brain Institute. Every single one of them said yes, which was awesome. And they actually met for the first time this past Monday. And the very first thing that they wanted to do, you may not know this region of Tennessee, but the advisory council folks listed here are very heavy on the Tennessee side. And because Ballad Health exists across 2 states, the very first thing the advisory councils did was they wanted to mirror those sectors on both the East Tennessee side and the Western Virginia side. And so they voted to do that. And so I expect that they're going to ask us to revise the charter so that they can basically double the size of the advisory council so that they have sectors from, they have members represented from both states. So what do we do? We've been working for a year trying to figure out what we do. And at the very time that we got the notification of the Ballad Health gift, COVID hit. And immediately we couldn't meet anymore. At least we couldn't meet on ground. We had to meet by Zoom. And then everything slowed down to a snail's pace. We had some core values. The members of the Brain Trust had some core values. One of our core values was doing science on ACEs and ACEs prevention in resilience provision. One of the things that I realized when I participated in the trainings was that everybody was training in ACEs, ACEs prevention. There was the trainers that Building Strong Brains Tennessee put out. So they trained people who would become trainers in their local communities, which is awesome. But nobody was doing the science on that. Nobody was verifying that what was trained in the train the trainer session, for example, was actually what was implemented in the sites. And so we thought one of the things that we're going to have to do is do science on the success or the fidelity of the training of the trainers. Also, no one was actually doing the science to see if ACEs intervention, ACEs information, ACEs awareness, whether that worked. Like if you go into a school system and you train everybody in ACEs awareness, that ought to mean something. There ought to be some kind of outcome measure. Like, do students go to school more frequently? Do they graduate more frequently? Are they, do they become expelled less frequently? Like all of these things are important outcome measures. Everybody was assumed was happening, but we don't know if it's actually happening until we do the science on it. And so one of our primary objectives in the Strong Brain Institute is to what I call wrap science around all of the ACEs efforts. But we also want to be an outreach arm for ACEs training, resilience training. That was Ballad Health. One of their primary interests in supporting our institute was that we would develop a certificate or some kind of program that we could put out into the community so that people could join us and be trained. We're working on that. We have a 4-hour training recorded, and now we're working on packaging that. We're thinking of that as a sort of badge program. We anticipate that'll be like a baseline training. I think of it as ACEs 101, and then we'll have add-on, sector-specific add-ons. So for example, we might have a K through 12 add-on. We might have a law enforcement add-on. We might have a judicial system add-on. So you start with the 101 training, and then you do the initial trainings, and for each one you get a badge or some kind of micro credential. Oh, incidentally, if you're interested, I can add you to our mailing list. So please type your email address into the mailing list, and I will ask Jen if she can copy and paste that into a document and send it to me so that I can add you to our listservs. The other thing we want to do is to communicate with all of our surrounding agencies that are involved in ACEs training and resilience promotion. So we're working on that. I met with Bristol's Promise just this morning, and I'm getting to know the folks in the region who are doing this hard work. We also do consultation. We do consultation about ACEs. We do consultation about science, about research development, about analyzing data, about interpreting data, and data presentations. Okay, so what have we produced? Well, I'd say the first thing that we've produced is the existence of the Strong Brain Institute. We were working on that for about 3 years, and I marked the beginning of the Strong Brain Institute at March 2020. The only reason I do that is because that's when I accidentally ran into President Nolan in the Atlanta airport. He was heading out. It's right at the beginning of COVID. I was heading back from some visit, and that's when he told me that we had received the check from Ballad. I'm like, oh, right, that's the beginning of the Strong Brain Institute. But that's kind of an arbitrary designation. The first thing that I did was I created 2 teams. I created the curriculum team, and the curriculum team, the goal of the curriculum team was to develop training opportunities and to think about how to implement trauma-informed awareness within the context of higher education. And I will say, one of our members is overseeing a trauma-informed minor in the Human Development and Learning Department of Communications. I'm sorry, Department of Counseling. We have one of the nation's first formal programs of study in trauma-informed care here at ETSU. And the other thing I did was I formed an institutional transformation team. And in that team, the goal of that was to figure out how you transform an entire bureaucracy to be trauma-informed. We have produced a few projects. One is we've applied for several grants. I list the RDC interdisciplinary grant there, #1, and I'll talk more about that in a second. But we've applied altogether for about six grants, mostly research-focused grants to do the science around ACEs implementation. One of the things I like to think we do is cause good trouble throughout the campus. We've held a few town hall events. We've produced a few op-ed pieces, and I have one student who's working on a dissertation related to this. I'll talk about each of these in turn. The curriculum team has people on it from all of us who are more interested in the training. So for example, Becky Haas, who's done a lot of training around our community, is on this team, and so is Andy Clements. Some of you know about Andy Clements. The 2 of them have trained something like over 5,000 people in Upper East Tennessee. So it's important to get them on there. We also asked the dean of our graduate program to be on there because she is technically my supervisor in terms of the administrative hierarchy at East Tennessee State. I already mentioned that we're developing badge modules, and we talked about having a major and minor programs of study. We have a minor program of study that's ready to go. The institutional team is a lot harder. What we're trying to do there is figure out how do you wrap trauma-informed practices around an entire college or university. And that's pretty hard because there are so many arms to a college or a university. There's faculty, there's students, there's various offices, there's hierarchical organization, including the president's office, the provost's office, there's financial aid, there's human resources, there's housing. How do you do that when everybody's very different? How do you approach it? One of our approaches is that we're going to have to approach it through training leadership. And so we've been focusing on leadership training opportunities within the context of our university. So we're going to focus on department leaders, area leaders, supervisors, working with them, sharing some of the trauma-informed principles. Okay. One of the things I think we could do is probably low-hanging fruit is identifying resilience-informed policy and procedure. Let me start over. Identifying policies and procedures that need to be trauma-informed. Like these are the kinds of policies and procedures that you run into when you say, why are they doing it that way? That's stupid. Or the kind of policy or procedure that makes you mad. Immediately, that's low-hanging fruit. We can change the policy. There's probably a rule why that policy exists, but it can be trauma-informed and it can be nice and friendly, and people don't have to be angry all the time when those policies get implemented. And then this last bullet's identifying appropriate. We've gone back and forth on this terminology, but what RISP stands for is resilience-informed strategies and practices. So one of the things that we want to do is figure out how do you apply, how do you measure where your university is? How ready are they for resilience-informed strategies and practices? Okay, so here's a project that is ongoing. It's pretty interesting. It's pretty exciting. To my knowledge, the first of its kind. One of the members of our group, Dr. Diana Moreland, received a $50,000 grant from an internal agency called the Research Development Committee. And they give a $50,000 grant every year to an interdisciplinary team of researchers. There's competition. It's highly, no, you don't get it automatically, but Diana had as her team all of us, which essentially was about 15 faculty, like I said, from 11 different academic departments in all 8 colleges. And what she proposed, one of the members of our group is a chair in the College of Pharmacy. So what Diana proposed was that we develop an intervention, we call it intervention, to resilience inform an entire ETSU academic college. And with the help of this faculty member, Dr. David Rohn, who is the chair of pharmaceutical sciences in the College of Pharmacy, we had access to their dean. The dean gave us the green light to go in there and do this study. So we're actually doing a study on the success of the implementation of a trauma-informed practice. And yes, it did go through the Institutional Review Board. So it's officially recognized and was reviewed for ethical compliance. We have pre and a post measure. We developed an intervention, basically trauma informing, teaching about ACEs, teaching about relationship building. Over the course of a series of events, a series of weeks, we implemented it with administration, with faculty, with students, and with staff in the College of Pharmacy. We had a pre-measure, we had a post-measure. We're going to have a post-measure, and right now we're still in the middle of that. So we'll have some science around whether it worked. By causing good trouble, what I mean is that I insert us whenever I see something that needs us inserted in it. So for example, we're in the process of hiring a new provost. The provost is the second in command to the president on a university campus. And when I found one of our members was on the search committee to hire the provost, and I asked, well, can we see the ad? And so they shared the ad with us, and there was no reference to trauma-informing ETSU. And so I said, well, if we're going to be trauma-informed, we're going to have a provost who buys into all this stuff. And so I suggested, will you let us add language that would recruit a provost who has experience understanding trauma-informed policies and procedures? And they said, sure. So we added a sentence or two, and now it says that we're looking for a provost. The ad is out now, and we're searching for a provost who, among other things, has understanding of trauma-informed policies. At the beginning of the return of the school year, the president came to us and asked us if we could help them develop language for mask wearing. Like, they wanted to tell all the students that they have to wear masks. At the same time, they were worried about how that would come across, and they didn't want to be too forceful or too authoritarian about it. So they asked us for language. And so we wrote up several ways to say, you need to wear your masks on campus. And also we gave guidance to faculty and others about how to respond when people weren't wearing masks. So we inserted ourselves there. Recently, I haven't heard a response to this yet, but our administrators are reviewed every 4 years, and the language that they use to review our administrators really needs to be updated. It's not very friendly language. It can be trauma-informed, and we offered to trauma-inform the evaluation documents. We have produced several town halls, and these are easy to put on, by the way. Basically, you advertise it, you put together a Zoom link, you advertise it, you put it out in the community, invite people to attend. Some of you may have attended our town halls. We had 2 major ones. One was the issue around, should you have your cameras on versus have your cameras off during a meeting? Something as basic like that, people are really conflicted over. I've been on meetings where everybody had their cameras off. I've been on meetings where people had their cameras or told to have their cameras on. And the problem there is that's not very trauma informed because people have reasons for having their cameras on or having their cameras off. But we didn't want to tell people how to do that. We just created an environment where people could come to our Zoom link and we could talk about some of the trauma-informed principles around why people have their cameras on or cameras off. Some of the reasons people have their cameras on is because they want to see other people. They need that social connection. Some of the reasons people have their cameras off is because they're embarrassed, either maybe where they live or what they're wearing or that they're eating or whatever reason. But any sort of mandatory cameras on or cameras off is probably not very resilience informed. So we had 2 town halls, one for ETSU on that, one for ETSU and one for the community. And then we had another town hall on emailing, talking about how to send emails or some policies around sending emails in ways that are thoughtful and trauma informed. We have published a couple of op-ed pieces in our local newspaper. We published the piece on cameras on versus cameras off. And we had another, this is more locally related, but our city council was considering whether or not to have an equity advisory board. And there was a lot of resistance to equity advisory boards. Some of the members said that equity advisory boards basically discriminate against white men. And so we had an opinion about that, and we wrote our opinion together. Again, we all contributed to it, and we submitted it to the newspaper, and it got published. And I have a student, Chelsea Robertson. She's a doctoral student. She's actually going to do a study on the receptivity of faculty to compassionate teaching practices. One of the things that you got to think about when you're trauma informing some place is who are going to resist you. Which kinds of people are you going to run against the most resistance for? And so that's what she's doing in her study. We think, for example, that maybe people who teach in the areas of psychology and social work and counseling or public health, maybe they're going to be a little more receptive to compassionate teaching practices. Whereas people who are, I don't know, we're just making this up, physics, biology, chemistry, engineering, people who are computer science, people who are less people-oriented, may be less receptive to compassionate teaching practices. So we don't know that. It's a hypothesis. We're testing it. We're going to see if that's actually true. But if we find out that it is true, that some disciplines are harder or less receptive, then that's important information for other colleges or universities to have when they try to implement trauma-informed practices or compassionate teaching practices. Our next steps are to continue establishing community relationships through outreach. That's one of the reasons that I'm here, so that you can get to know my face, so you can hear about the SBI, so that you know out in Upper East Tennessee, we have an organized, funded focus on preventing and mitigating ACEs. The work of the curricular and institutional teams are going to continue. Like I said before, we have a recording that's available, but and we want to make it completely automatic, sort of asynchronous, so that you could register for this training. I imagine there'll be some sort of pre-test. You take the pre-test, you watch the video with appropriate breaks, you take a post-test, and on completion of the post-test, you get awarded some sort of badge or some sort of credential that you can use that's official, that's recognized by your employer, and possibly you could get a raise, or maybe it's mandatory that you get training in that, so that you can do that. So that's done, but we're packaging it right now. The core, the engine of it's done. One of the next things I think we're going to do is in the sector of policing. We're going to have because we have Becky Haas, and she worked in the police department. She is going to work with us in developing a policing module. Others might be K through 12 education, child care and advocacy. We'll just have to see, and we can do them very slowly because everybody who's doing this work is doing it above their day jobs, over and above their day jobs. And so the work goes kind of slow, but it's really good work and it's persistent. And the institutional teams working working forward to develop trainings for leaders. One of, I think, the low-hanging fruit for that one is teaching leaders how to run meetings. There's actually an excellent science around running effective meetings. There's a great book that you can check out called The Surprising Science of Meetings. And there are people who dedicate their careers to finding out which are the best ways to run meetings. Which things should you do and which things should you not? One of the things you should do is have an agenda, for example. If you don't have an agenda, if you're having a meeting without an agenda, nobody knows why they're there. So that produces uncertainty, and of course, that's not a very trauma-informed approach. So we'll probably do a training for our leaders on how to run a meeting. Another key component, one of the things I'm focusing on, is establishing psychological safety. Effective organizations thrive when the employees feel comfortable speaking their mind, even if their views are not popular. You have to create a climate in your work environment where people can speak their mind without being judged, without fear of criticism, without fear of being shamed. Most of us aren't trained that way. Most of us are trained to make fun of people when they say something that we think is stupid or something that is naive. But you can't have an environment where new ideas are created or established when people are afraid to speak those things because of the shaming environment that you may have established. So another key component, in addition to the science of meetings, is promoting psychological safety in our units. Sustainability is really important. We have this really wonderful gift from Ballad Health that will last 5 years. After 5 years, we have to be able to be on our own, or we go away. Now, it'd be really super nice if Ballad would give us another $5 million. Short of that, there are several funding agencies out there that support this work. There's federal and there's private foundation funding agencies. So one of our staff that we hired is a scientist. She actually has been out for 5 years. She got her Ph.D. 5 years ago. She's full-time in the Strong Brain Institute. She just started January 1st, but we're hoping that she can assist us in writing for grants or write for some of her own grants, but also do the science around those. So we hope we get some big money coming in. Very slow going, but we're prodding along. And of course, we're going to be working with our advisory council. We're very interested to see where they think we should go. And with the multiple sectors represented, very interested in the feedback that they'll provide. Like I said, we do have a listserv. We have a listserv for internal friends of the SBI, that is people inside ETSU, and external friends of the SBI, which are everybody else. If you'd like us to add your name to that listserv, it's very low traffic listserv. I think I've sent in the last 3 months, I think I've sent out 1 email. But we announce, one of the things we'll do there, for example, is announce trainings, and we'll announce like town halls. We're working on a newsletter that should be coming out in the next quarter. Very soon we'll have speakers and webinars, and we'll continue with our town hall meetings. Okay, that's it. That's all I have. That's the origin story. The one thing I'll say, the reason that we focus more on resilience than trauma-informed is not to diminish the role of trauma-informed, but what I found is that when you talk about trauma-informed practices, trauma-informed care, you immediately exclude a whole segment of the population who isn't interested in trauma or trauma-informed care. So, for example, I did a presentation of the Strong Brain Institute in a group of faculty, and I talked about trauma-informed care. And they said, well, why are you doing that? They already have a counseling center they can go to, or they already have, social workers who they can go to. Why are you focused on trauma-informed care? Immediately, when you talk about trauma-informed care, the assumption seems to be that you're focusing on people's deficiencies, people who have trauma histories. That's all you care about. Well, really, everything about trauma-informed care really is in everybody's best interest. If you employ trauma-informed practices, everybody's happier, not just people with trauma histories. Trauma-informed care translates into being nice, having a nice environment, being friendly to people, being respectful, being compassionate, treating people as if they're human. I mean, that's really what trauma-informed care is. And everybody benefits from that. So by focusing on creating environments where that's the focus, if you talk about resilience, then everybody can buy in. Everybody wants to be more resilient. Everybody wants to work in a place that promotes resilience. And that's moving on strength based. That's developing based on strength rather than deficiencies. And so that's why we're really focusing on the resilience language. One of our challenges in doing that, though, is for some people that's a disconnect between language around trauma-informed care and resilience, promoting resilience. People might think that they're different things, and they are different things. I don't want to underplay that. But the focus, by focusing on resilience, you do lose a connection sometimes with the people who are thinking about it only in terms of trauma-informed care. So that's a semantic issue that we're working on developing, but I'm sure that we're up to the task. So that's all I have, and I'm very interested to see what feedback you have or what questions you have.
All right, wonderful. Thank you so much, Dr. Dixon. I will tell you, I've already gotten several private messages from folks talking about how grateful they are, how much they've enjoyed this presentation. So I feel like it's certainly been very useful. If you all have questions, please feel free to put them in the chat. There's a chat and there's a Q&A. It's a little easier for me to navigate the chat. There's a little chat bubble in the bottom right-hand corner of your screen, or should be, that'll allow you to see that. So I'm going to read the questions aloud for the benefit of those who will watch this recording later. They won't be able to see the questions that you all are chatting in. So I'm going to I'll start with chat, and then I'll move and make sure that I haven't missed anything in the Q&A section. Lots of people want to be on your listserv, Dr. Dixon. I have captured all of those folks. Another question that we had was from someone asking to see the newspaper article you're referring to, and so getting a link to that. And so if it's possible, I said to her that I could include that link in the recording when I send out the recording. Is that possible?
We actually already have that.
Oh, you already have the link?
You do. I sent it to you once before.
I believe I do. I will go find it. I will make sure that it gets out to everybody. Thank you so much. Okay. Let's see here. So if we already have a degree, is it possible to go back and get credentials in these major and minors?
That's an excellent question, and I forgot to mention that. This badge that we're thinking of does not require any previous education. You don't have to have a degree. You could have, maybe you've dropped out of high school. You could get the degree. You could get this badge without regard to education. You don't have to have a degree to get into this program. Alternatively, people who already have degrees could also get this credential. So what we're trying to do is make it available to everybody without regard to previous training.
I love that. So the next question I have is, and I think you just answered it. It says, will there be a badge for healthcare workers? Okay. And so this is universal, and so it can go to anybody, right?
So I think the speaker is asking about sector-specific training. And so we have this basic training, the 4-hour training that I mentioned. What I'm thinking of is Trauma-Informed 101 or Resilience 101. We haven't labeled it yet. And then there'll be sector-specific trainings. And absolutely healthcare, health work, because we're funded by Ballad, and 2 of the Ballad's vice presidents are on our advisory council. You can be very certain that one of our earliest add-on modules will be in the healthcare industry.
Wonderful. Seeing if there's any other, let me go to Q&A for a minute. And those of you who have questions, please feel free to put them in the chat while I'm navigating Q&A. Let's see. Okay. So the first one says, and I think you answered this, that there's a differentiation. It was earlier in the presentation. It says, I'm curious why the need to create training when the state of Tennessee has already done this through BSB. Do you want to talk about the differences between those?
Well, we don't envision this you can't always get this training from BSBTN. It's not always available. And so, you know, the trainings are few and far between. I've been to one, it was several months ago, and maybe there's another one coming up. But you also have to go to it, and you have to sit there, which is great. The one I went had Becky Haas, but that used up 3 or 4 hours of my time. And that's primarily for people in Tennessee. Our training would be anytime you want, from anywhere in the world that you want, as long as you speak English. You could get the training from Japan or China or Africa or wherever you want. But it's not meant to be different or better than BSBTN. It's really meant as a supplement. And also that was our charge when we were given the gift from Ballad Health. Their charge was for us to produce this training.
Wonderful. Next question, do you believe there will be a doctorate track developed that would align with the Institute's efforts? Did you say no, Dr.
No, I said,
Okay.
Yeah, so that's a really very broad question. So not specifically with the Institute. The Institute really isn't in the business of offering like a degree per se. We would advise on offering a degree or consult on it, but we don't actually have degree training within our institute. But what I was thinking of is that's becoming more and more popular, and I think there are probably doctoral programs popping up. Well, I know there are. I just couldn't tell you where they are. In areas particularly like in social work, or in public health, or in counseling, psychology. There are those programs out there where it's not the main focus, it's more of a specialty or specialization. But yeah, as far as our institute goes, we don't actually train in degree granting programs.
Excellent. The next question that we have is trauma-informed care and resiliency seem to be a fairly new focus. Are there any studies or research being done by the Institute on adults who identify as having had a high ACE score of ACEs and the challenges they face?
So if by adult you mean college students, there are faculty in the Institute who have done research on that. I don't have the studies handy for me to share with you. If you send me an email though asking that question, I can send it out to the right people and we can get back with you with the relevant studies.
Wonderful. Last question I see. Dr. Dixon, this is a fantastic presentation. Does SBI collaborate with researchers outside of ETSU? Are there ways for researchers outside of ETSU to get involved with SBI?
So the quick answer to that is we're kind of new. So not really, but it's more like not yet. If you are interested, shoot me an email. Some of you may be interested to know that one of the things coming up is our institute at ETSU, we're setting up a meeting with at least 10 other universities nationwide who have something similar to our institute. We're going to establish a meeting with them and talk about commonalities and future directions. So that's just kind of an opening, a meet and greet with other at the university level. But we have had a couple of people who have expressed interest in working with us, and we've invited them in, but we're too new to have like policies and procedures around that. But if you have a particular interest, again, send me an email and I'll forward you to the right person.
Wonderful. I don't see any other questions, so if you've got one that you're typing, go ahead and get it out there. Maybe we'll give it one more minute. See if there are any lingering questions. Okay, well, thank you again, Dr. Dixon, for such an excellent presentation. Clearly from the questions and the responses, it was really helpful for lots of folks. So with that, I will say, We had Q&A light up. Hold on one second. Let me make sure it's not a question. I'd hate to miss out. Okay. Will the slides be online? So Dr. Dixon, are you, would you be okay with us sharing a .pdf version of your slides?
I think so. Yeah, I don't think there's
Okay.
anything on there that's secret or proprietary.
Good deal. All right, the chat is lit up again, and it seems to just be thanks and thanks and thanks, and it's wonderful. But I'm sure you can see that.
Anytime.
So with that, I'll go ahead and wrap us up and say thank you again. And thank you all for attending. And I hope you all have a great rest of your day. This recording will be live by this time tomorrow, and you will get an email from me with a link to our YouTube page. I want to plug in and say that we have lots of other great webinars and training content on our YouTube page. So we even have a Building Strong Brains playlist. So if you find yourself with some time or some interest, please head over to YouTube and just if you type in Tennessee Commission on Children and Youth, it'll be the first one to pop up. All right, everybody have a great day. Hold on a second. I'm still on camera.